Okay, good afternoon, everyone, and thank you for attending this session of Grand Rounds. It's 12 o'clock, so we're going to go ahead and get started. I'd like to welcome our presenter for today, Missy Travis, who will be presenting on the topic of balancing home life and safety in long-term care facilities. At this time, I'm going to stop sharing my screen and turn the presentation over to Missy.
Thank you so much. Okay, can you confirm that you can see my slides?
We can see.
All right, perfect. Thank you guys so much for joining me today. I'm really excited to share this practical information with you. I've found as an infection preventionist that we get a ton of technical and scientific information, but not a lot of practical information. We have to learn much of that on our own. So today I'm going to be sharing some technical information, but also giving you some practical tips about examining the environment while also keeping in mind that this is someone's home. This is where it can get a little tricky, but we are going to work through those issues today. So first I need to share a couple of housekeeping items. There are several skills and concepts that I want you to take away from this presentation today. These are all listed here under our objectives. So hopefully after this session, you will be able to describe the 5 main areas assessed during rounds, develop a customized rounding tool for your facility, identify the primary sources used to determine regulations and best practices, apply the latest regulations and best practices in your facility, and assess your current program for effectiveness. So let's start by examining this important question. What is the environment? Let's review Webster's definition. While several were listed, this one resonated with me the most in terms of healthcare. And Webster defines it as the circumstances, objects, or conditions by which one is surrounded. Before we get started learning new concepts, I want you to reflect on another important question. Why is the environment important in a healthcare setting? What makes it different than a public setting, such as a grocery store or a social gathering? This is an important principle when we are discussing infection prevention in a long-term care facility. We will come back to this question in a little while, but keep thinking about it as we go through some key concepts for environmental rounding. Before we can dive into this question, we need to review some key points about the evolution of long-term care over the past several years. Let's review each one. We are now seeing higher acuity of residents in long-term care. We have residents with advanced age. We all know that we're living longer because we have better treatments and better health habits. We're also seeing residents with more invasive devices, which can increase their risk for infection. We are seeing more multi-drug resistant organisms. Of course, more regulations, a growing population, and then the need for renovation of some of these facilities just because they've gotten older or there's more people there, and so now they need additional room. And then, of course, the COVID-19 pandemic added to the stress that was already on the system of long-term care. Speaking of more regulations, let's take a look at this chart that outlines the 10 most frequently cited health deficiencies. As you can see, 4 of them are related to infection prevention. I don't know about you, but I have trouble remembering things sometimes. And so for that reason, I love creating acronyms and other tricks to jog my memory. As we discuss doing environmental rounds, we are going to talk about the 5 C's. Hopefully, this will help you remember the main areas we need to review in terms of infection prevention. Here are the 5 C's. Let's explore each one in detail. Let's start with the most obvious, cleanliness. This is a no-brainer. The facility has to be clean to be safe. Is the facility visibly clean? Do you see any obvious dirt? What I like to do is come in the front door, and what are your first impressions? Are there odors? How do you know items are clean? Do they keep logs for their cleaning process? Can staff describe the cleaning process? This is a big one. When you ask staff that question, can they describe it? Can you observe anyone? I like to tell the story about a facility where I worked, and we were having an outbreak of C. diff, and it seemed to be focused on one particular wing. And in that wing, we were looking at all sorts of things in terms of staff, but I was also looking at environmental services. And on that particular wing, we had a very experienced environmental services tech. She actually did excellent work. I was, not really concerned about her performance. She had been there for several years. I had observed her in the past. But just because we continued to see cases, I thought, I'm just going to watch and make sure that she's doing the right thing. And we had changed disinfectants like in the prior few months. And so I thought it would be a good time to do some more visual observation. So as I was watching her, she was doing everything great. But then when she got to the sink, I noticed that she wiped down the sink, and then afterwards she dried it with a paper towel. And so any of you all who have done infection prevention for any time, you know that this is a no-no. We don't want to go back over surfaces with a paper towel. We've got to let it completely dry so that we ensure that it meets that contact time for the disinfectant on the surface. That's the only way that we know that it's going to be effective according to the manufacturer. And so instead of allowing it to dry, she was drying it with the paper towel because it looks nicer. A lot of times people who are very caught up in the aesthetics of things, they want that dried appearance. And that was exactly what was happening here. And so after she did that, that gave me the opportunity to go talk to her about that and explain to her why we didn't need to dry that countertop, that we needed to leave it wet for the appropriate amount of time. So sometimes you will pick up on those things whenever you're doing some of those visual observations. What disinfectants and cleaners are being used? Are they EPA approved? And the way you find out if they're EPA approved is you check the label. Also, you want to make sure that everyone knows the contact time. And are they using the appropriate PPE? Another good indicator is to check the housekeeping cart, because sometimes people will tell you they're doing something, but when you go to the cart, you will find something different. And I have found this myself over the years just in doing environmental rounds. You also want to look at the ventilation. Are negative pressure rooms negative? And are positive pressure rooms positive? And I know that those sound like obvious questions, but sometimes we take for granted that everything's working properly, that the fans are working properly. And you can do a really simple tissue test to confirm if they are working correctly. Many of your newer facilities have monitors outside those rooms, but it's important that everyone knows what it means when the monitor goes off. And so I like to ask the question during my rounds of staff, do you know what to do when this monitor goes off outside the negative pressure room? And you would be surprised how many people do not know what to do when that alarm goes off. You also want to look at the wall coverings and the paint. Are there chips and tears? Because we know that penetrations can make it easy for germs to hide. Are furnishings and equipment clean and in good repair? I have another story I want to tell you, and I'm sorry if anybody's eating lunch. I don't want to make that hard for you. But I did have an incident in another facility where I worked where we had a patient that was recently admitted to a room, and I got a call to go up to the room because something had happened. And when I got up there, we were talking to environmental services and also to the patient care manager. And basically what had happened is this new patient had come into the room and they had a visitor. And most of the rooms, have one of those recliners for either the patient or the visitor. And the visitor sat in this recliner and they got very comfortable and propped up the footrest. And when they did, they got quite a surprise. What had happened is the prior patient had also sat in that chair. and had had an accident. And, everyone thought they had cleaned the chair very well, but what they forgot to do is to prop up that footrest and clean that little space. There's a space in between the footrest and the seat, and usually there's a little piece of fabric there. And that particular area had not been cleaned, and there was some leftover stool in that area. And as you can imagine, the patient and the visitor were not very happy about that. But what I learned from that experience is we really can't take things for granted, and we need to check all of our furniture, all those crevices, to make sure that they are clean. So we added that to the cleaning list for environmental services to make sure that they were propping up those footrests. Finally, the most dreaded subject I find is pests. Are there any signs of pests? Do you know how to check for bed bugs? You can look at the seams of the mattress. You can look at the sheets for tiny little blood spots. If you've done infection prevention for any amount of time or worked in a healthcare setting, you've probably run across this situation at some point where someone has either been suspected of bed bugs or just people are a little paranoid about it. A simple way to start when you're looking for cleanliness is to begin at the top with the ceiling and just work your way down. And then just write down what you see. Are there wet or missing ceiling tiles? Are there dusty ceiling vents? Peeling wallpaper, damaged carpet? Are there liquids on the floor? The horizontal surfaces, are they clean? Are you noticing that clean and dirty are separated from each other? Is the splash zone clear? If you're not familiar with the splash zone, it's the area immediately around the sink. You don't want anything clean stored just immediately around the sink because it can be splashed with water and become contaminated. Also, you want to make sure there's nothing stored on the floor that is clean because we do not consider the floor to be clean. And I know this is a lot of information, and we've just started with our first C. So now you're starting to see why long-term care facilities are different from a public area. Now that we covered the principle of overall cleanliness, let's talk specifically about the cleaning process. Let's start first by addressing this important question. And if you've gone through an inspection, you have probably heard it. How do you know it's clean? Well, it's hard to know 100% that every surface has been cleaned, but there are some indicators. One way is to institute cleaning logs and check for completeness. Another way is to check cleaning using a fluorescent marker or ATP monitoring. Finally, you can watch the process, and this is what I described earlier. This is time-consuming, so you might only be able to do this periodically. While none of these methods are perfect, if you use a combination, you will have a good idea of what is going on with the cleaning process. While the process is very important, it's also critical that you are using the correct cleaners and disinfectants. Check the label to make sure they are using an EPA-approved disinfectant for healthcare facilities. I found that many environmental services techs or housekeepers like to use bleach. In fact, I recently did an environment of care survey in an LTAC where they were putting bleach into spray bottles without measuring or labeling the bottles. And this can be problematic. While bleach is a great disinfectant, it is not a good cleaner, so it requires 2 steps. Plus, if you are mixing it yourself, it needs to be discarded at the end of the day. If you're doing high-level disinfection, logs are required to confirm that the disinfectant is maintained appropriately. I know it sounds like common sense, but the manufacturer's instructions on the label should be used to determine the appropriate practice. And you would be surprised how many people do not look at the manufacturer's instructions or look at the label. What tools are being used? Are they using microfiber, brushes, mop heads, etc.? How are these being cleaned? Where are they using them? How are you handling resident personal items? Are they keeping their items clean? Are they able to clean around the items? This is where balancing safety in the home really makes a difference. We want our residents to have their personal items and be comfortable, but we need to make sure they are not creating a safety issue. Are residents sharing items or bringing in things from home? It's important to talk to residents and families about your commitment to infection prevention and safety. If you only remember one thing from this presentation, I hope it is this next concept. Clean and dirty have to be separated at all times. This is one of the most important concepts for environmental infection prevention. Anytime you are thinking of making a change to storage or a process, use the filter of clean versus dirty to make sure that you are keeping to this principle. Another component of cleanliness is storage practices. Because we need to ensure that the items are kept clean until they reach the resident. For storage, I want you to think 2, 5, 8, and 18. We need to be 2 inches from the outside wall in terms of storage, 5 inches from the ceiling if there's not a sprinkler head, 8 to 10 inches from the floor, and 18 inches from the ceiling if there is a sprinkler head. And a lot of people just use the 18 inches so they don't have to remember both of those measurements. It makes me itch just talking about it, but we have to. It's pest control. Do you see evidence of pests? Ask staff if they are seeing any bugs or other pests in any areas. A big one is residents leaving food out in their rooms. And also if people are leaving outside shipping boxes in the clean areas. I recently did an assessment of an outpatient clinic, and I did see a handful of pests as we were walking around. And guess what else I saw? I saw quite a few boxes in the clinic, and many were on the floor. And these are outside shipping boxes, meaning these are the boxes that still have the shipping label on them. So they have actually been on a shipping truck. And a lot of times those trucks, they don't have to be clean. We have no idea where they have been. And many times they're exposed to the outside elements. So oftentimes you do not want to bring those boxes into the facility if you can all keep that from happening. This can really contribute to your pest problem. Another thing to look for is, are people leaving the door open? This can sometimes be difficult to balance, especially if you're wanting to increase air circulation and improve ventilation. But in most instances, you need to keep the door closed, and perhaps even use some screens if you're looking at increasing the ventilation. Let's move on to the third C, which is controls. Controls are the various entities that influence the practices in infection prevention. Let's explore the various controls for long-term care facilities. I like to break this down into 4 main groups. The first is federal. These are regulations that have to be instituted. The groups include CMS, OSHA, FDA, and EPA. It's important that you know all the regulations that apply to your facility. But let's discuss a few that you're going to look for during your environmental rounds. In terms of CMS, do you have an infection preventionist who is managing the program? Do you have an infection prevention plan? Is it evident as you are making rounds and noting the other areas we discussed earlier? For OSHA, there is the general rule and the bloodborne pathogen standard and the TB standard. My favorite thing to look for, and probably the most frequently seen discrepancy, is food and drinks in the clinical areas. Are there negative pressure rooms? Are they functioning correctly? Are the exhausts blowing anywhere that people might be passing by? So remember, for the negative pressure rooms, those are those isolation rooms used for people with airborne infections. And so they are supposed to be exhausted to the outside of the facility. They're also used for your biohazardous rooms. And so that exhaust that is blowing to the outside, you want to make sure that it's not blowing somewhere where people could be walking by. Most of the time, they're going to be on the roof, but you just want to ask and make sure that it's not in an area where people could be passing by. Are sharps boxes blocked in any way? That's another big one to look for on the rounds. The FDA regulates food and some types of PPE and other products and drugs used for residents. Is the PPE that is being used FDA approved? You can find this out by checking the label. For food preparation, it's important to look at temperatures and storage. You can find the appropriate times in the FDA food code. EPA regulates the disinfectants that we use in healthcare settings, as I mentioned earlier. Are the current products EPA approved with a number on the label? So typically you can just look at the label and there will be an EPA number listed there. Each state typically has rules and regulations for the different types of healthcare facilities. You want to become familiar with them so that you know what to look for in your facility. So Kentucky has their own rules and regulations for healthcare. This may include how you handle hazardous waste. There may also be some CDC guidelines that have been made into a rule for your state. Some states also have their own OSHA that has jurisdiction. You can also look at the accreditation bodies for long-term care facilities. The most common one is the Joint Commission. The Joint Commission has standards for various healthcare components, one of which is infection prevention. And you will want to look for compliance with the standard while doing rounds. Finally, there are best practices. These may not be laws or regulations, but they have been proven or are part of an expert consensus to be the best practices in various situations. These typically come from professional organizations such as CDC, APIC, AMI, ASHE, etc. CDC has created best practices to prevent certain types of infections, such as catheter-associated urinary tract infections and central line-associated bloodstream infections, as well as isolation precautions and enhanced barrier precautions. You will want to add these to your checklist to make sure that any applicable CDC guidelines are being followed in your facility. For most long-term care facilities, this will include the catheter-associated UTIs, the central line-associated bloodstream infections, infection prevention in the environment, isolation, hand hygiene, cough etiquette, and safe injection practices. One example would be to look if Foley bags are on the floor, and are they scrubbing the hub when they use peripheral or central lines to give medications? Are multi-dose vials being used and stored appropriately? You can really just look through those guidelines and see which ones would be applicable to your facility. Since we are talking about controls, the next one we want to talk about is compliance. And this really can be a tough one. While you are walking around, you want to get a feel for how compliant staff are with policies and procedures. So how do you do this? You observe their practices. Remember, for hand hygiene, PPE, and cough etiquette, you want to watch everyone. This is also a good time to ask open-ended questions, like, what type of PPE would you wear for a resident with Candida auris? You can also talk to residents about hand hygiene and if they see others doing hand hygiene. Don't forget about beauticians and barbers and other contracted professionals who are entering your facility. You can use this time to talk to people about their vaccination status. This can help you identify barriers and myths. It can also give you an opportunity to share the facts. Finally, look for signs of presenteeism. If you're not sure what this is, it's when staff are coming to work sick. We have all been there. You don't want to disappoint your coworkers, so you come in even though you are feeling sick. I had this happen not long ago before the COVID-19 pandemic when I noticed a nurse wearing a mask in the break room. I started with the obvious, why are you wearing a mask today? Come to find out she had a fever, chills, and a cough, and she later tested positive for the flu. Post-pandemic, this is a little more difficult because it's really not unusual to see staff wearing masks anymore. But you can look for other hints such as tissues, coughing, their face is red, their eyes are glassy. You also want to look for these same things in visitors because we do not want them coming into the building if they are sick. Our next C is codes. This encompasses all of your policies and procedures. Some of these you have already captured when looking at compliance. You want to make sure that the policies in place are being followed. If the policy states you will keep a log, ensure there is a completed log. If the policy requires a certain type of documentation, check to make sure the documentation is complete. You also want to do some observations. Are they actually doing what they are documenting? Finally, there are areas where you need to do a risk assessment because the policy either doesn't apply or is not reasonable to implement. The final C is comprehension. Does the staff understand infection prevention? Are there educational needs? How frequently are they being educated? Have you done a needs assessment where you've actually asked staff, where do you still have some needs in your education? Do you know how the staff prefer to learn? Do they like to come to live classes? Do they like to do modules on their own? Do they like to do a big safety fair where they walk through and look through different things? During your rounds, you can get a lot of information through hallway conversations when you're asking these open-ended questions or just being available for people to ask you questions. What are your frequently asked questions? Those can be a good indicator of the educational needs. Your observations can also be a good indicator. Another tool is a root cause analysis. If there have been any infection prevention events, sometimes this will be done to identify potential causes. Typically, lack of knowledge surfaces as one of the culprits. Okay, so finally, we want to create your checklist. And when you are creating a checklist for your facility, you want to go through the 5 C's and then determine what is applicable to your facility. Which of those governing or accrediting bodies applies to your program? Use those documents or guidelines to guide your checklist. You can create a checklist using whatever program works best for you, but I do recommend using a format of met, not met, or partially met. You might also consider using a program that allows you to sort like items. This would be helpful during the analyzing step. You can also pick something that can be used electronically during your rounds or just good old-fashioned paper. I've tried both, and I think it's just a preference issue. I like to include partially met to give credit to those who are trying because sometimes it is out of your control when an item is not met. I would also include an area for both comments and follow-up actions. This is important for when you go back through to identify issues and follow up. Finally, just use it. For most tools, you are not going to get it perfect on the first try, so you have to get out there and actually apply it in practice to see what else you need or what is not applicable. So create your checklist and then take it for a spin. Now comes the fun part. You want to analyze all the good data you have collected during your EOC rounds. The worst thing you can do after rounding is throw your checklist into a file and forget about it until you do rounds again. We need to glean important and valuable information from the rounds. So how do we do that? First, let's review the results. After we have reviewed our findings, we can start analyzing what those results might mean in terms of infection prevention practices. An easy way to start this process is by grouping the common themes. This will help you identify trends. Are there any gaps? Are there knowledge deficit gaps, compliance gaps? Are we missing a policy and a procedure? Is there a process that is not working so they are doing a workaround? It's important to have a process in place to report your findings. Sometimes this is as simple as sending an email to the department directors or reporting at a staff meeting. You also want to report your findings at, if you have an EOC committee meeting or whatever committee is overseeing the environment. Use this time to connect the dots. Are there correlations between the findings and the IP data? How can we use this information to give feedback to the staff? The next step is to decide if follow-up visits are needed. Sometimes the issues you find are so egregious that you need to follow up immediately or have it fixed on the spot if possible. Some examples would be not using the appropriate disinfectant in an outbreak, Another example would be food not being stored at appropriate temperatures. Create a reminder for yourself to check the trouble area again to see if the changes you made to see if the changes made a difference. You might consider doing this before you conduct your formal rounds again and keep a record of issues. This is important because it's easy to forget what you found 6 months ago and time goes by quickly. Develop a plan. This doesn't mean that you as the IP need to do all the work, but you want to make sure that someone is taking responsibility to make corrections. Finally, let's talk about accountability. I suggest that you take it a step further and take names and establish dates for completion. Don't leave it open-ended. For many IPs, the follow-up actions is the hardest part of this rounding process. So we have covered very quickly how to do environmental rounding and how to kind of balance that safety and home environment. So my final call of action to you is just to determine your 5 C's and add them to your checklist and start rounding. And these are the references that were used for the presentation today. So thank you so much for your time and attention.
All right. Thank you so much, Melissa, for that wonderful presentation. And at this point, I'm going to open it up to the group for questions. So if you've got a question, please unmute yourself and ask Ms. Okay, well, if any questions arise after this presentation, feel free to send me an email and I'll get that question off to Missy. And so thank you to Missy for this wonderful presentation. And please join us next week where Dr. Hudson Garrett will be presenting on the topic of updates to the AAMI standards, a look at endoscopes and ultrasound probes. I look forward to seeing everybody then. Thanks so much.